Hello, my name is Tabitha Robertson, and today I would like to spend some time speaking with you about clinical depression. The name of my assignment, what I've chosen as far as using or speaking about clinical depression, is a closer look at what exactly clinical depression is. So let's get into it. um, True clinical depression is an illness. It is a mood disorder in which feelings, sadness, loss, or frustration interfere with daily living. Um, Most cases, it's changes in mood and behavior for extended periods of time. We all go through emotions as human beings, walking through life, where we may have some downtime, feelings of depression, loss. We may experience those matters or those changes in emotion for things, maybe some life changes, divorce, loss of a loved one, being away from family members that you're normally close to. I know personally for myself, I experienced a few bouts of depression when I got married, even though that was a happy situation, but I was leaving the close knit family that I have to move a couple of hours away from them, and that was difficult as a new wife. But clinical depression is different. Clinical depression is when certain changes in life you're unable to adapt to them, and this is for long, extended periods of time. The aforementioned symptoms are just a few of what you may feel, but it's overwhelming sadness, grief, loss. You're unable to make clear decisions. You're not able to be decisive in your decision making. And in those instances, this is when you tend to get a diagnosis or you may need a diagnosis. Now, clinical depression is one of the disorders where it's very difficult for people to get diagnosed. Normally, that takes a very long time. People tend to live with clinical depression for long periods of time without having a diagnosis. I mean, first of all, they may not even understand what they're experiencing. Um, then they may be embarrassed by what they're experiencing. And then some of them just really don't want to go to the doctor. And we probably all have a loved one that's like that. May it be for psychological reasons or it could be just for their physical health, not necessarily wanting to go to the doctor. So that's not too abnormal, I would say. Well, going into more into clinical depression, there are two types. I plan to discuss that more so in my PowerPoint presentation. Um, and they are major depression. Major depression is normally what people call clinical depression, but I'm going to talk a little bit more about the fact that it is very different. Major depressive disorder is a combination of brain chemistry and family history and the psychosocial environment. So we're going to talk a little bit more about that and the issues that may arise from that. Clinical depression is something that is can change in your life, can be a major factor in your life and the quality of life that one has. Without proper diagnosis, it can be very detrimental to the standard of life, the amount of life. We also talk about or hear about how some there are some issues within the community where without proper diagnosis these people are harmed, and it may not be a thing that's meant to happen, but in the news we may hear about people with psychosocial disorders or for instance some type of clinical depression or just some type of misdiagnosis that once was not treated properly. They end up in the criminal justice system, things of that nature. So we want to try to avoid that. um, Statistics show that in children that have parents that have suffered from this illness, their chances of being diagnosed are very high. If both parents, of course, the chances are greater that a person becomes diagnosed with clinical depression. It's a very serious disorder, one that tends to be overlooked from time to time. Treatment of the disorder is doable. where it can help with the lacking of the brain function, because this is where the illness tends to start. It's when the brain starts to react differently and um, process differently. Um, the treatment can be dual. It can be with counseling, and also can be with medicine. It could be separate, or it could be brought together. Um, in my opinion, with working with children that have been diagnosed with clinical depression and bipolar disorder, it seems to me that the counseling and meds together seem to be more effective. I worked with adolescents for about 6 years when I first entered into school, working on my undergrad, and it seemed as if to me, and from the counselors and psychologists and psychiatrists that I work with, that the combination of the medication and counseling, the therapy together, seemed to be the best treatment, at least for the children that we were dealing with at that time. So, at any rate, I hope that this video gives a good impression of what I will be speaking about, what my presentation as a whole will be about, and hopefully that I can effectively give an in-depth viewpoint of what clinical depression is all about. I appreciate the time. Thank you so very much, Professor, for this entire session, this entire semester. 7 weeks blew by, so I really do appreciate it. Have a great day. More to come. Bye-bye.